Hi, my name is Lee. I'm the nurse practitioner student from US University. Today I will do the neuro exam on my patient. Before I get in to see my patient, I will review his chart, collect all the equipment, wash my hand, and when I got in, I will provide the privacy and I will identify the patient and ask for the consent. Hi, my name is Lee. I'm the US NP student. Is it okay if I can get the consent to put the video on YouTube for my instructor can see it?
Yes.
Can you tell me your full name
Tino Chan,
and your date of birth?
8/2/1972.
Do you know what day today?
Today is the 14th
You
February.
know, okay. You know what is who is the United States president?
Joe Biden,
And you know where you at right now?
the House.
Okay, that's good. So like the patient is alert oriented temporal. Uh, his facial expression is appropriate to the situation. He have a good eye contact, and when he, I can see he have a well dressed, well groomed, and good hygiene. He respond quickly to my question, comprehensive, speak is clear, no abnormal order. So I will start my neurologic exam by the cranial nerve. First, I will check the cranial nerve number one, uh, olfactory. I will let him smell, and I will tell him describe the order. Can you close one nostril first?
Okay.
Okay. Can you breathe in, breathe out? Any difficult?
No.
Any pain,
No.
discomfort? Okay. Another side. Can you do another side the same? Okay. How is it? Any difficult when you're breathing and out?
No.
Any pain or discomfort?
No.
Okay. So when you close your eye, I will let you smell something and you can tell me what is it, okay?
Mm. Alcohol.
Okay, that's good. So he able to describe the order, so like cranial nerve number one is good. So the next time I will check the cranial number two. Um, it will be the uh, ophthalmologic exam. I will look at the optic nerve behind his eye, and I will try to look for the red reflex uh, when the light reflection in the pupil. And after that, I also will look in the structure behind the pupil. I will look for the optic disc and the optic nerve. When I see the cornea, the lens, and located the red reflex, I will follow the red reflex and see the orange yellow structure. I can see the blood vessel, and I follow the blood pressure. I can see the optic disc, and the shape of optic disc usually round or oval, and the margin distinct and sharply demarcated. The nasal edge may be slightly fuzzy, and the cup disc ratio, when visible, usually brighter yellow white, and the white is not more than 1.5 this diameter. Okay. Let me check. Can you look at my eye? Okay. Open. Okay, do another side. Look up. So I can see his optic disc and the blood vessel, and I can see the red reflex. Now I will check the cranial nerve number two and three for pupillary reaction. Um, I will shine the light to his pupil. So I watch for the constriction of the pupil and to check if it's equal, round, and reactive to light for both. Okay. Can you look at okay me? Don't move. Okay. Okay. Good. Okay. So if the pupil constrict, equal, round, and reactive to light, the next test, I will do the assessment on extraocular movement for cranial nerve number 3, 4, 6, and also I check for the nystagmus. Number 3 is ocular motor, cranial nerve. Number 4 is cochlear. Number 6 is abduction, all involved in the extraocular movement. Okay, so can you follow? Good. So he have a normal extraocular movement and he doesn't have a nice stomach. The next one I will check for the cranial nerve number 5 is terminal. Check for sensory and motor function. For the motor function, I will put my hand on his jaw, try to tell him tight his jaw really good and move his jaw side to side and clench his teeth. Okay, can you clench your teeth? Okay, okay, good. Okay, can you count? Good. And next, I will check for the sensory function. Um, I will tell him one side is soft and one side is sharp, and I will check. Can you tell me what is it?
Let me close my
No.
soft, sharp.
Okay, that's good. So the next time I will check for the cranial nerve number 7 to see his facial and especially the facial movement. I will ask him smile to see if normal, symmetrical, or any weakness of one side. Okay, can you smile? Okay, I can see it's even and no weakness one side. So the cranial nerve number 7 is good. Number 8, I will check for his hearing. Um, I will start with the whisper test. I will stay behind you and I whisper something and can you repeat?
Apple,
Okay.
balloon,
Okay. That's good. So the next one I will do the Weber test. This is a screening test for sensory and conductive hearing loss. And I will activate the turning fork and I will put in his middle forehead and I will ask him if he hear equally both sides or one better than another.
both sides.
Okay. And then I will do the ring test. I will place the same thing, tunnel fork on the mastoid bone and I ask him when he no longer hear the sound. At that point, I move it uh, outside, close to the outer ear, 1 to 2 centimeter, and ask him again when he no longer hear it. Okay. Sorry. Please stop. Tell me when you not hear.
Not here,
Okay.
not here,
Okay. So I will do the same thing.
not here, not here.
Okay. So he have a negative test. He have a positive negative test is he have a normal test. He able to hear the sound when moving the tunnel force next to the ear. The next one I will check the cranial nerve number 9 is glossopharyngeal. I will ask him open his mouth and say R. Uh, I will check for the symmetry of the upper palate and the uvula and the tongue supposed to be in the middle position. Okay. Can you um let me see. Open. I will check your now. Open your tongue. Okay. And say R. Open. Okay. Say R. Okay. It's good. So I can see like his uvula and the tongue in the midline position, and when he say R, I can see the uvula rise symmetrically. And the next one, I will check for the cranial nerve number 10, vagus. I will use the same, this one, to touch the patient and observe him, and also like observe him like if he have any difficult of swallowing. Can you swallow? Okay. Can you close your eye? What is it?
So.
Okay. So it's good. The next one is cranial nerve number 11 is accessory and spinal accessory. I will place my hand on his shoulder and have him shrug his shoulder upward to me. Okay. Can you shrug? Okay, good. Okay. So the next one, I will place my hand on his chin and have him try to move his neck again. Okay. The cranial, the last one is number 12, which is hypoglossal. I will ask him stick his tongue out. Um, I want to see the tongue supposed to be midline, and if it's not supposed to be deviate toward one way to another, because it will show like if you have some injury of the spinal cord. Okay, can you stick your tongue out? Okay, so I can see it's right there. It's good in the midline. Okay, so that's good. Now I will do the motor function and coordination, the coordination test. I want to see his gait, the posture, and if he have any involuntary movement. Okay, so I want you to stand up. Okay. Can you walk a little back and forth? Okay, a little bit right here, turn around. So you have a I can see he have a good gait balance and it have a good posture, and I don't see any like involuntary movement. So now I will check for his muscle atrophy. Can you step up, turn around? Okay. So I will check the big muscle group, the bicep, the tricep, and like the forearm and thigh and leg and the thumb muscle to see if he have any muscle atrophy. Okay, so can see this side. Okay. So he doesn't have any muscle atrophy, and I also check for the muscle tone and muscle bulk. Uh, he doesn't have any ridges or flexed tone. And for the muscle strength, I will check for the strength and compare both sides. I will check the, okay, when I push, you try to go against it, okay? Do it like this. Good. This time. Yep. Okay. So, can you like this? Okay. And then I will do the, um, I will try to close this and you try to open it, okay?
Okay.
Close it. Okay. Close. Open. And I try to open and you try to close it, okay?
Okay.
Okay, good. Try to close it. Okay, that's good. So can you hold like this? Okay. I try to press it down and you try to go against it. Okay. Okay, good. This one. Push it down. Good. And now do the same way, okay? Push it down. Okay. And I try to push down and you try to lift it up.
Okay.
Okay, good. So I can see like he have a good finger strength and he have a good muscle strength for upper extremity. And now I will check for the lower extremity. Can you move inside? So I will check for his quad and hamstring and the hip abduction. Okay. And I do check this one. I push it down. You push up. Okay. Good. Okay. Another side. Same way. And I see. Let me see. Then let me see the camera. Can see. Do it again. Okay. 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 And you push it down. Good. Do another side. Okay. Good. So can you lay down? So we will do the sorry. And I will do the hamstring flexibility test. Okay. And you lift this up. Okay, push it down. Good. One. Okay. And now I will do the hip abductor and abductor. Okay. So I will try to push it up and you push it down. Okay.
Okay.
Good. Do another side. Okay. Good. So I do like opposite way. I try to press it down and you try to lift it up.
Okay.
And lift it up a little bit. Hold on. Do it like that. Okay. Good. This one. Okay. It's good. So now I will check the knee. Okay. You do the same. Let me see. I try to push this way. Okay. You try to go again. Okay. Okay. This way, same.
Okay.
Okay. This one. So now I try to close your knee, both, and you try to open it. Okay.
Okay.
Okay. Good. So I try to open and you try to close.
Okay.
Okay. Okay. That's good. So now I will do the coordination exam on him. For this test, I will start with the rumble test. Can you stand up? So for this test, you want, okay. I want you close your eye. Okay, put your shoulder up. Your shoulder like this. Good. Yeah. Up like that. Okay. So can you open your eye? Okay. Close your eye. Okay. So I can see like he can stay upright position without minimal swaying, and he not lose his balance. The next step we'll do the pronator test. It will be the same position. While he closes his eye, I will take his hand and to quickly press down and to see how his return. Okay. Okay. Close your eye.
Okay.
Close your eye. Okay, it's good. So um, I can see like his gait. Um, I will ask he take a couple of steps back and forth and to see and turn around so I can see him how he walk. Um, okay, can you can walk back a little bit? Can you make few steps right here? Okay, turn around. Okay, go back to the same place. Okay, can you swing your arm? Yeah, okay. So he have the normal posture and balance. And now I will ask him do the tandem walk. Um, I will ask you walk on your heel and then you walk on your toe uh, in the straight line, okay?
Okay.
Like this.
Oh, okay.
Walk on your toe like this.
Okay. Yes.
Okay. Okay. Ready? Yeah. Just do normal like this. Toe. Look. Toe. And then toe.
Okay. Oh,
Okay.
okay.
Yeah, like that. Good. Toe. Okay. Turn around. Do the same. I can. The camera didn't see it. Can you try it one more time? Sorry. Right. Yes. Fine. Can you walk on your toe
Yes.
like that? Good. Okay. Turn around. Okay. Now, can you walk on your heel? Yeah. Just like straight line like that. Can you do it like right here? Look on your heel.
Okay.
Heel. Right. Okay. Walk straight.
Okay.
Yeah. Okay. Can you do on your heel again?
Okay.
Like like this.
Okay.
Look.
Oh, okay. Yes.
Okay. Okay. So, um, the next one I want you to sit in the middle.
Oh.
To be careful. Okay. So now I will check the rapid alternating movement with the hand lap. So can you do like me? Like this? Yeah. Turn around. Yeah, like that. Yeah.
Okay.
Okay. So can you do faster? Okay. Okay, it's good. So like I can see it's a smooth movement and I don't see any choky and the flow is appropriate. Now I will do the point to point movement. Okay. When you when I point something, you point to me, and after that you point to your nose,
Okay.
and wherever I point, you follow it
Mhm.
and point to your nose. Okay?
Okay.
Can you right here? Good. Okay, it's good. So he have no problem with that. Um, I will do. I will check for the test for sensation. It will again with this one. I want to see if he have a. He can. He will know the doom side or the sharp side because sometimes like diabetic people, uh, they usually lost the sensation on the toe and the feet.
Soft. 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 Sharp.
Okay. Toe,
Soft. Sharp.
the toe.
Soft. Sharp.
Okay. So he have a good sensation on his toe and his feet. And now I will check the deep tendon reflex for both sides. For the deep tendon reflex, I will get this tool. It's a hammer. So I want to see how his reflect. Usually like it grading from 0 to 4 plus. 0 is mean no response. Number 1 plus is diminished or low normal. Number 2 plus is average and normal. Number 3 plus is brisker than average. Maybe it showing like the patient need for further workup. And number 4 plus is very brisk and hyperactive with clonus. It indicates the presence of disease process. So I will check the bicep tendon to check for the contraction of the bicep muscle for the elbow flexing, and the tricep tendon usually for the elbow extension uh, for the nerve C6 and C7. The patella tendon will be checked for the knee extension for the L3 and L4. Uh, the last one is AQ tendon. Usually I check the plantar flexion of the foot for S1 and S2. So now I will do the I will do the to see the bicep. Okay, I will hit here a little bit. Okay, just relax, relax. I can see a little bit twisting movement right here. Okay, that's it. Do another side. Relax, relax. Okay, that's good. So now I will do the tricep. Just try to relax, okay? Relax. Okay, good. Okay, relax this side. Relax. Good. So now I will check to his knee. I want to see any um, reflection. Let me see. Okay. Good. And now I will check that's the patella. Now I will check the IQ. Let me see right here. I will check the IQ right here. So the last one I will check the planta for the baby skin. So the baby skin reflex is one of the normal reflex in the infant. Um, when like it's supposed to be normal in the children up to 2 year old, but it will disappear after that. But like when the baby skin reflex is present in the child older than 2 year or in the adult, it's usually often a sign of a central venous system disorder. The central venous system, including the brain or the spinal cord. Now I would check that reflex. Okay, I will let you lay down. So um, I will check for his to see like his I want to see his big toe is dorsal reflex or the other toe fan now. Okay, that's good. So he have a normal reflex for this one. Okay, my exam is done. Do you have any questions for me?
Oh, no.
Okay, I just finished my neuro exam. Thank you.